afternoon, folks. Brandon Garrett here with the National Minority Equality Forum. As you know, it's Friday. We like to edutain, as I like to say, and we're going to talk a little bit about, actually, it's our second webinar around this topic, which is also going to be led by Courtney Lang, who is the founder and principal of Langco Plus Partners, a health justice consulting practice. And so she's going to talk about turning data into action, state advocacy, community health, and the new data disaggregation toolkit that they've worked on. I usually have something funny or pun to say about what's going on, but I think we're just going to go straight into the topic. So that was my funny pun, but I'll let Courtney go ahead and the experts that she's gathered here today lead this conversation.
Thank you so much, Brandon. And we are delighted to be with you all today. On behalf of the Data Equity Coalition, thank you. Our discussion today will intentionally focus on the states, specifically our state advocacy efforts. And while federal demographic data standards provide an important foundation, many of the policies and decision-making and community programs that shape healthcare at the community level are implemented at the state first. So our conversation is really to ensure that every single individual is seen, every individual is counted, and every individual is represented in the data that informs policy, program, and community health for the broader system of healthcare. And so with that, I am pleased to introduce our panelists. First, Aishat Magbade, who serves as the Senior Director for Legislative and Regulatory Policy and Community Health Policy for Blue Cross Blue Shield Association. She is joined by LiHang Jacobo, the Principal Operations and Portfolio Manager at Blue Shield of California, focusing on health equity, and Gretchen Wortman, who leads NMQF's Center for Public Policy and serves as the Vice President of Policy and Program. Gretchen, I'm going to turn the floor over to you to help us have context for the Data Equity Coalition and just to remind the audience how data disaggregation helps us better understand the unique needs of the populations that we serve to support informed decision-making. With that, Gretchen, the floor is yours.
Well, thank you, and my thanks to all of you who have joined us today. I would like to say I can always rely on Courtney Lang to say what I should say before my time comes, so she makes sure that the gap is filled. What we have at the moment, which is 2026, is 4 years of a very successful partnership with Blue Cross Blue Shield Association, we, the National Minority Equality Forum. And that has resulted in a significant advancement in data standards that are precise and enable the visibility of populations in the American general population. And I will also say that at this moment, I'd say it's extraordinarily important. It's more important than we envisioned in 2022, that this data equity coalition has been in place and has the ability to continue to work to assure that all Americans are visible, can be seen, can be counted as our system moves forward into a future of I would say, health policy that creates an infrastructure for inclusion that's essential. I will stop there. I know we're running late, and turn the floor back to Courtney to continue.
Well, Gretchen, thank you so much for your reflection and acknowledgement of the Data Equity Coalition. And that really helps to set the groundwork for Aishat, who we're going to turn the floor over. And Aishat, help us just to understand for the audience the evolution of the State Advocacy Toolkit. It was designed to translate complex policy into practical action. But before we talk about implementation, it's really important to understand why the work matters. Why is this matter so significant at this moment in time in history as an opportunity for states? And so can you begin by sharing what prompted the development of the State Advocacy Toolkit and why advancing more representative demographic data is important to every single individual watching this webinar today and in the future?
Thanks, Courtney. Yes, I'm so happy to be with you all today. The federal government and state governments exchange data all the time. So it's really important for the data that they're exchanging to be aligned. So when the federal government updated SPD 15 in 2024, this presented an opportunity for states to also update their own data standards to align with the federal government. So it became imperative for states to actually take a look at their own data collection practices and ensure that they aligned with the federal government's own data collection standards outlined in the 2024 revision of SPD 15. Additionally, data disaggregation is becoming increasingly important as states look to see how they're going to allocate resources, how they're going to address disparities, or how they're going to address different policy issues that they are facing or that their communities are facing, and how they're going to continue to form and shape policy within their states. And having states update their policy or their data collection standards to these new standards will ensure that state level data collection remains sound and remains easy to exchange data on the federal level, and also ensure that data disaggregation remains smooth and ensures that the different communities and populations that live within their state remain visible and people are able to be seen within the data that is collected on the state level. So that's why the State Advocacy Toolkit is really important. It's important for advocates to use when engaging with their state legislators and other state advocates and policymakers within their state to ensure that these people that are making policies within their states understand what the changes are, understand what the impact of these changes will be to their constituents, and understand the breadth of data collection within their states and how different modes of data collection need to be updated to ensure that they are aligned. So when 2029 comes and the federal standards are going into effect, that the states aren't lagging behind. So when the federal and state data collection that happens continues to happen in a smooth way.
That's a perfect overview. And you referenced the federal standard. And I think it may be helpful for the audience, maybe to see a few of the slides that you had provided that just sort of show a little bit of context for what is the federal standard, what was the issue brief that kind of served as the foundation or the genesis of the work. So I'm happy to share those slides and maybe you could just walk the audience through just briefly.
Yeah, that'd be
Okay,
great.
awesome. Okay, well, we are going to begin, not at the end, but in the beginning. And so we will do that. Thank you. All right. All right. Well, you know what? We will generate this right here. There you go. There you go, Aishat. Sorry about that. Okay,
No,
that's
totally
okay.
fine.
Little tech support. There it is. Okay, there's
Okay,
your foundation.
thanks, Courtney. So, as Gretchen mentioned, BCBSA and NQF started our collaboration about 4 years ago, And it actually first started off with this paper that standardizing data to advance the health equity movement, a multi-sectorial strategy. And this was really the foundation for the Data Equity Coalition, really highlighting the need for data standards across race, ethnicity, language, sexual orientation, and gender identity. And this brief also made recommendations to OMB to update Statistical Policy Directive 15, also known as SPD 15 for short. And we actually were very successful in having OMB update SPD 15, which they did in March of 2024. So within this update, we had a number of wins, including a combined race and ethnicity question, expanded categories for race and ethnicity, including the addition of the Middle Eastern North African category, which was separated from the white category, which was very important for data disaggregation to ensure that that community is not invisible any longer within the data and becomes visible in the data that's collected, which is really foundational to achieving health equity. Data is foundational to achieving health equity because if we don't have the data, we don't see the disparities. And if we can't see the disparities, we don't know what to fix. So through this, we were able to advance policy, engage with political leaders and lawmakers, and also educate the community and other healthcare stakeholders. And then through this, we also were able, like I mentioned, to have the combined race and ethnicity question into one question, and then have expanded categories, including also the ability to check your ethnicity underneath the race, and write in your ethnicity if you don't see it listed underneath the race or within the question, which is really important for people to, again, be seen when they are actually filling out these questions. Um, and then for other things such as SOGI and disability data, those that wasn't included within the scope of SPD 15. That is something that we continue to advocate for because it's really important that people are seen within the data that's collected and that data standards reflect that. We really believe in having an intersectional lens when it comes to data collection standards and data and how people self-report data. We feel like it's not beneficial to just have not self-imputed, imputed data where people just assume who you are based on a number of different factors like your zip code or what your last name is, but that you feel comfortable actually writing in who you are, and have that transparency about how the data is going to be utilized, and that you feel comfortable showcasing who you are through the data. So that is the foundation of the Data Equity Coalition and the work that we're doing.
Thank you.
And then with the State Advocacy Toolkit, there's a number of different advocacy resources that we included in there that we can talk about a little bit later.
Absolutely. We're going to walk through just images of the state toolkit, but I wanted to give Val an opportunity to jump in because I have often said that California is the best practice when it comes to data disaggregation. And I continue to affirm that reality, Val, and just so completely proud of the work of the advocacy movement in the state to really bring data disaggregation to light and to life. And was hoping that you could kind of give us an illustration of a little bit of the advocacy work that really helped to generate the legislative success that you have realized within the state of California.
Thank you, Courtney. Talafalava, everyone. Wa o savalu filemu tomlatai LiHang Jacobo. Maila ayamatsangofiam alosina. Good morning from California. I'm speaking to you all from the ancestral lands of the Tongva, Ahashiman, and Chumash nations, and so grateful to be here among my esteemed colleagues here. California is very interested in collecting detailed demographic data that Aishat just ran through. But for us, I believe it's more than just the data collection piece. It's how the data is utilized to improve health outcomes, right? So California's experience has shown that data equity is not just one policy or one law. It's an ecosystem. AB 133, SPD 15, interoperability priorities that we focus on. And while every state has different political and operational realities, there are several lessons that are broadly transferable from California. And that's the piece that I want to talk about today. Number one is that we've learned that community has to shape the data. And we heard from Gretchen, right? Visibility is so critical, and not just to community should not just be on the receiving end of these reporting and these data collection that we're talking about and highlighting today. I believe that's the first lesson that is meaningful. The collection of the data begins with community voices, and many of California's advances have come because communities asked not to be grouped together in ways that mask important differences and mask disparities. So communities should help define what's collected, why it's collected, and how it's ultimately used. The next piece that I wanted to highlight, Courtney, is standardization, right?
Okay.
Standardization
Yeah.
also creates consistency and trust and scale. I think that's also very important. And California recognized that early on, that if every organization collects demographic data differently, you won't be able to compare apples to apples, right? You won't be able to compare outcomes or identify disparities and consistently across the ecosystem. So this is at the heart of California's AB 133, the catalyst behind tying health equity goals, California's health equity goals, to a broader data sharing and interoperability framework. So that lesson there is that demographic data only becomes useful at scale when it's collected consistently.
I love that. And the fact that AB 133 actually highlights a very specific and intentional framework. It's an important lesson that other states can learn from and glean insights into how we convert the concept or ideal into actionable improvements for the entire care delivery system within a state. I just wanted to kind of lean in on that. Is there a best practice, if you will, a piece of advice, a lesson learned from California that other advocates who are watching this webinar could take with them as a lesson learned from all of the work in terms of mobilizing communities and galvanizing different interests within the state to really help to affirm data disaggregation?
Absolutely. Data collection should always have a defined purpose, right? We shouldn't collect information just to collect information. That's how you get community involvement. We have to collect information so that it answers questions. For example, who's experiencing poor outcomes? Who's having difficulty accessing care? Where are language services needed? Which communities experience higher denial rates? This is all the data that health plans are collecting, and the healthcare ecosystem has this information. Where are the preventive screenings being missed and by whom, right? If we can't answer those questions and we're not able to see that information in the data, then we have to rethink the questions that we're asking. The other piece, as I mentioned earlier, is interoperability, right? Most of us think of interoperability as a systems issue. It's a communication system. It's the ability for a member to take their information from one caregiver to another, from one caretaker to another caregiver, and so forth, right? But in California, it's more about coordinated care. It's not just connecting computers. And this may be California's biggest opportunity moving forward. Interoperability is, as I mentioned, described as systems talking to one another, right? And there's a lot of complex, very smart people working on that technology piece. But but interoperability really is about people. It's about the
Yes.
ecosystem, right? It's the responsibility of coordinating care for other people. And that's the maturity that I see from California. So when demographic information follows a person across providers, health plans, hospitals, community organizations, care then becomes that village concept, right? It becomes coordinated. That's when you'll start to see evidence of what's culturally responsive, what's linguistically appropriate, right? That's the evidence of what we mean when we say we are centering people. So people can be felt not just by the numbers, right? But also by the way in which we are utilizing data to drive operational decisions. So that's where California has begun to mature, and we're seeing a lot more, a lot more support from regulators in terms of operationalizing the data that we have through data equity principles.
I love that. Interoperability is about connecting care, and the data is really speaking to the heart of the people movement. Seen, represented, counted. This is what we talked about. Aishat, this is sort of the perfect segue to providing the audience with a visual depiction of the State Advocacy Toolkit. It speaks to the why, the motivation of what Val just kind of presented and gave an overview for the audience. And so hopefully no tech issues withstanding. I'm going to try to give the audience a little bit of a visual so you can walk them through the toolkit here and provide a level set for what we are talking about. State, okay, so it did this thing, but that's okay. We already did this, you saw this, and here is the toolkit. All right.
Thanks, Courtney. So in April, the Data Equity Coalition published the State Advocacy Toolkit and debuted it at NMQF's annual Leadership Summit at the end of April. This toolkit is intended to be used as a resource for coalition members, other advocates to use on the state level to advocate for other states to use with state legislators to advocate for aligning with SPD 15. So we can go to the next slide. The next slide includes model resolution language that we could use to with national organizations, such as organizations with state legislators that often adopt resolutions that serve as commitments across key issues such as maternal health or rural health across their states. So including language to adopt resolution language around data collection standards to align with the 2024 revision of SPD 15 will ensure that any data collection on these key issues like maternal health or rural health or disability also includes these updated standards to improve data collection and data disaggregation. The toolkit also includes model legislative text that can be used by state legislators to update their state data collection standards to align with SPD 15 and codify these standards into law so that any data collection practices on the state level align with SPD 15. The text provides sample language that aligns with these standards to ensure that all state level data collection practices are in line with these new revisions and include all of these standards in this manner. Then we also have one-pagers that can be used with policymakers as well as healthcare stakeholders that indicate why SPD 15 is important, why it impacts us and our healthcare, why it matters, and what our role is in better data, and why data disaggregation and why standardized data collection is important for us. So this is really important to just share. And then finally, we have community talking points and one-pagers that are written on the third grade reading level so that we can go into the communities and actually explain to the people why this matters to them. Many people, I'm pretty sure everyone has filled out their race and ethnicity in some sort of form, job application, or anything like that, but they may not understand why it's actually important and why it actually matters. Some people may not even fill it out because it is voluntary. So these talking points and one pagers actually help them to understand why it's important for them, how it impacts them on their day-to-day life, and how it actually trickles down into different aspects of their lives, from care coordination to community health, and how it actually impacts them, like when they go to the hospital or go to their doctor's office, and why they should actually care about SPD 15. Then the one pager talks about what SPD 15 is, how it actually goes from the government policy to their everyday life. And then it also includes an image of what the combined question looks like so they can understand like what the changes look like, because the previous revision was 1997, so most people only know the 1997 version of SPD 15. So many people only think there is only one ethnicity, and they don't understand that there are multiple ethnicities. They may not understand, like, oh, I can check multiple races this time, or multiple ethnicities, or I do have the option to write in my ethnicity. So these are the components of the state toolkit that are really helpful in just advocating for alignment on the state level, but also going and doing some grassroots outreach on the community level to improve health literacy, and just doing some education on the community level to help different populations across this country understand what SPD 15 is and why it does matter to them.
Thank you so much, Aishat. That was a great overview. And I think we should just reaffirm that SPD 15, Statistical Policy Directive 15, is focused on race and ethnicity, but the Data Equity Coalition's advocacy extends beyond race and ethnicity. The minimum standards is what was articulated in the 2024 update, but our work and the work that Val has been championing in California and so many states across the US have been working on is beyond the minimum. We have the minimum, but beyond the minimum. Language, disability, sexual orientation, gender identity, as well as geography. And this is why the democratization of data is so critical. So for all of the panelists, if we take data disaggregation and we're collecting data, but we're not acting upon it, what is the danger? What happens if we collect, but we don't act? And so I just ask that to all three of the panelists to just give thought to that. If we're collecting, but we're not acting, so that the advocates that are on this webinar today understand the critical importance of this time and space in history to make sure that they're converting their advocacy to action. Converting advocacy to action. Val, I'll let you kick that off and then we'll go around.
I think the greatest risk is that we lose sight of what the real currency is in our day and age. The real currency that we need to be thinking about and operating around is trust. And that's what this kit is all about, right? It's how do we build the trust? It's providing the language, providing the education for trust, for those who are in the business of creating trust and building transformation systems across this ecosystem. And that's the greatest risk. If we lose the trust of our communities who we are asking for their information on, and data collection is a promise. And we have to keep that promise as those of us in healthcare, and use it according to what they understand we will use the information for, right? Blue Shield of California, we're a nonprofit. We will never sell data, right? That's not even in our line of business. But what we will do is ensure that the data that our members entrust us with, that our communities have given us, will help improve our care, improve their care, reduce disparities, and inform better decisions as a health plan.
Thank you, Val. Gretchen, I'm going to let you jump in here and offer some reflection. We're collecting the data, but we're not acting upon it. Give us your thoughts and reflections on that aspect of data disaggregation.
Well, actually, I'm going to go a bit upstream from
Okay,
that and
sure.
say that the Data Equity Coalition is establishing standards that can be used to define data collection efforts. Okay. For the National Minority Quality Forum, Blue Cross Blue Shield Association, that's very much a conversation that they're then engaging in through the health lens. But the data standards are issue agnostic. The issue we are advancing is the essential nature of assuring that the population of the United States is reflected in data that are collected. And I'm saying that because others, and answering your questions, what happens if we don't act? Then others will act. And we cannot always control how they interpret the data that they collect. So all of those who are participating on this call, I would say, please continue to assign value to assuring that we're standardizing data collection, and that then you're viewing your your essential sectors through the lens of the data that are available or can be made available, and because they're standardized, linked to data from other sectors. I would say I'm going to maybe show my age here, but as I was preparing for this call today, and yes, we NMQF started working on this issue with Blue Cross Blue Shield Association in 2022, and my introduction to it was fairly quick. I mean, I think I had a deadline to meet that was a couple of weeks. All right. And so what I started doing today was thinking back to what the world was like in the last century prior to 1977. And why we're having this conversation. And we essentially had a world in which primarily males, Caucasian, non-Hispanic males, were counted, and everybody else was this great other. Okay.
Deep, yes.
And so when I look at the Statistical Policy Directive from 1977, that started that conversation of disaggregating that other and helping people see themselves, see America for the diversity that it is. We then had the 1997 update, and then 2024. So we can share that information, because actually the document that's available from OMB regarding pre 1977 is something from someone's desk.
Yeah.
All right. Finding something in the internet, asking the question, what data were being collected prior to SPD 15? What comes up is this. And that also then, I would say, reinforces me the essential nature of assuring that our history, of which we are now part, as we move forward, continues to be reflective of everyone here. And what we are doing is helping assure that those who assign value to precision
That's right.
in our messaging and our numbers have access to the data they need to move their issues forward, whether it's banking, whether it's housing, whether
That's right.
it's health or non-health.
That's right.
Precision in the data is essential.
Decision in the data is essential, Gretchen, and that is a perfect understanding and level set for how this conversation evolved from data standards to data collection to data integrity to data action. Aishat, you understand firsthand from the community health lens, right, why data standards are so important. We have not sunset that work. But can you help just to frame for the audience the data standard imperative that Gretchen just alluded to, why we started that way, and how the advocacy work continues to build upon that important foundation? We talked about at the beginning of the call, seen, represented, and counted. So please give us a little bit more depth to how that foundation continues to inform community health from an advocacy lens.
Yes, thanks, Courtney. So the risks if this data is collected but not acted upon is that disparities are going to continue to be exacerbated.
There it is.
If we don't act upon it, and we know that the disparities exist and we can see it in the data, but we don't do anything about them, the disparities are just going to continue to widen. And if that happens, then we're never going to be able to achieve health equity. And the gaps are just going to continue to grow. And that's incredibly problematic because we know that these disparities exist. And we know that with the data that we've been collecting, we can see where the gaps exist. And through policy, we can fix these gaps, we can correct these gaps, and the data can inform how we can correct these gaps and what we can do to, through policy, through regulations, through laws to correct these gaps. So it's important that we take this data and we use that to inform our policy making. And if we don't do that, then our policy making will just continue to be written in a way that makes communities that are experiencing these disparities continue to be hidden, continue to be invisible. Our policy making will only consider certain people, will not consider the people that are being counted in the data, but they're being hidden. They're not being, the data that we are collecting is not being acted upon. So it's really important that through this data that we're collecting, we're actually doing something with it. And we're actually taking action to do something to correct these disparities that we're seeing and close this gap and actually use it to achieve health equity. I think that's really important for us to keep in mind that data standards is just the beginning.
Yes.
It's not something that we're just going to just have and then not do anything with it, but we actually have to see this as, again, foundational and something that we can see as aspirational for what we want to achieve moving forward.
Perfectly stated. Perfectly stated. Gretchen had alluded to the term other. And this came up during the NMQF summit in April, along with trust, right? And so one of the attendees after our session in person asked, why is other so problematic? Why can't you all just be other? Val, I'm going to turn that one to you. Can you explain what's at stake by generalizing populations and just lumping everyone together? What is at stake for communities in our healthcare system?
Yeah, communities will remain invisible when data is aggregated in a way that masks all of the disparities and all. When we saw that during COVID, right? We saw when many of our communities were aggregated in a way where where there was inequitable distribution of vaccines and equitable layers of policy that prioritized certain illnesses over others, or or communities over others. It was a very difficult time for the nation at large, right? But we weren't prepared infrastructurally to help support decision making at the time. And so we saw a lot of the rapid acceleration of data disaggregation in California, because many of our local health officials, local counties, were the ones that started doing that. And why? Because communities were asking for that. Communities were experiencing that. I also saw in my own community so many funerals around me, so many aunties and uncles hospitalized. And yet I did not see Native Hawaiians and Pacific Islanders as a risk category. And why? Because we were aggregated as a generally healthy API community, right?
Right.
Which is the Asian and Pacific Islander aggregation. And only through the disaggregating those two very these are not monolithic communities either,
That's right.
right? Either Asian Americans and Native Hawaiians, Pacific Islanders. It was only through the disaggregation that we were able to actually justify why attention needed to be placed on those communities who were experiencing higher obesity rates, who were experiencing higher other morbidities that needed to have the attention in order for equitable vaccination to be distributed across LA County and other counties across California. So it's really important that the goal behind our data collection is about better care. And better care means looking at the demographic data and connecting. And I mentioned this earlier, connecting our demographic data to operational data, right? Like claims, appeals and grievances, who's filing these grievances, quality measures, connecting that. And because what that leads to is better coordinated action, and it leads to what Aisha was saying. Like, what do we need to do next? How do we act upon this information? We measure it, right? Because only then will the evidence be visible so that the decisions can be made.
Yes. And friends watching, if you have an opportunity to drop a question into the chat, we will take questions from the audience. I know we did get one or two in, but I want to make sure that I verbally state that. If you have a question, please feel free to place that into the chat. Val articulated an important truth about the danger or what's at risk when we lump communities together, and had also previously raised the importance of trust. And Gretchen, I'm going to turn to you just with that trust question. This also came up during the summit, just around the whole notion of trust. And is it okay? Is it safe to fill out forms? And this always comes up in healthcare in particular, where communities don't necessarily feel comfortable, or they feel potentially at risk or vulnerable, right, by completing demographic data on a healthcare form. My question is, how does the notion of trust impact the healthcare delivery and financing system that you oftentimes refer to? But can we work together as advocates to help demystify that in a way that helps to empower individuals so that they feel the necessity and the power in actually completing data, demographic data?
So it's a long question.
Okay.
My reaction to the trust issue, which may or may not be where you want me to go, is that and filling out the form.
Yeah.
Regardless of whether you fill out the form, the system is taking action based upon your existence.
Yes.
And so they're imputing who
Mm-hmm.
you are based
Mm-hmm.
upon your zip code or your skin tone or your hair texture or your weight or your height or age.
Mm-hmm.
And so the filling out the form, this is a generalization, does not create the vulnerability.
Mm.
It creates an opportunity to engage more in a more informed way to
Yes.
counter the vulnerability that you already feel because
Mm-hmm.
you feel that the system is not operating in your best interest. Okay.
Mm-hmm.
And so as we have the conversations about trust,
Mm-hmm.
I'm not going to hold those who don't trust responsible for the fact that they don't trust. I think they're responding in an intelligent and informed way to what they know is a hostile environment, but not stepping forward doesn't stop that environment from behaving the way it does.
Mm.
And so it's always a risk
Mm-hmm.
when you are functioning within a construct, a societal construct that you feel may not have your best interests at heart, but you cannot disappear. Your children will not disappear. What happened to those who preceded us will disappear if we don't make ourselves visible.
Fantastic. Thank you, Gretchen. And before I turn over to the questions from the audience, Aishat, if you could just round out this line of thinking, of foundational understanding to the State Advocacy Toolkit, because it speaks to education, trust, and the importance of community health and data literacy in a way that is digestible and understandable for the average everyday person, because we did not want the work to be at such a high level that individuals who are just interfacing in and out of the system of care didn't feel like they could relate. Can you speak to the importance of utilizing the tools in the toolkit to help to dispel disparities, to empower individuals around trust and data representation that they own, not imputed data, but that they own?
Yes, thanks, Courtney. So the toolkit, like we mentioned before, is really important, of course, to advocate with your state legislators, but it's also really important to explain the importance of this data on the community level. Trust is really important, and having people understand why their own data and taking ownership of their own data is equally as important. As Gretchen mentioned, like people are going to impute data about you on their own. So taking ownership of your own data and understanding that you are in control of your own data and how you are represented is really important. So using the toolkit to share with the community why this is important for them, how it impacts their daily lives, to improve their health literacy, to improve their data literacy, to help them understand how it impacts their individual lives, how it impacts the lives of their families, how it impacts the lives of their communities around them, would be really important for them to understand that this is an issue that is going to impact them across the board. It has already impacted them
Mm-hmm.
throughout their lives, and it's going to impact them through the rest of their life and through their future. So helping them to understand why this is important will also
Yeah.
help them to build that storytelling and community voice. So if
Engagement,
you
right.
do want to take them also to their own state legislator to understand, like, this is why this matters to me. This is why you need to pass this bill within our state so that I am represented in the data that my state is collecting is really
Yep.
important as well. So it's not just the federal government, it is the state. If
Yes.
I'm from Maryland, I want Maryland to collect data in a way that I'm represented. So it's
Yes.
really important for community voices to be part of this conversation as well to ensure that everyone is counted in the data that's collected.
You matter. That's what we want the audience to
Exactly.
take away. You matter.
Exactly.
You always matter. And we hope that this conversation helps to continue to fuel the power that you have as an individual. There was a question that came in, and I want to make sure that the panelists get this question because I think it's essential. The question is, what does data equity mean to each of the presenters, and is it attainable in our current environment? I thought that was a brilliant question. Gretchen, you want to take that first?
So I will say it's attainable, but it evolves. I'm going to go back to pre-1977.
Okay.
And then the 1977 data standards, the 1997 data standards, and the 2024 standards. As we get more information, we understand what additional factors need to be counted. And so I will say that can we attain it? I think we can attain the value, assigning a value, whether it's at the state level or the federal level. But is there some fixed point in time where it's done? No.
Yeah. No.
Too much is going to change.
Constantly evolving. That's
absolutely. So I will leave with this, which is that we count what we value and we value what is counted.
We value what is counted.
And continue to work towards that.
Val, data equity, can you define it, and is it attainable in the current environment?
I mean, I remain optimistic, and more so because data equity is not just a policy conversation anymore. It's becoming an operational conversation, especially in healthcare, right? Health plans, our providers, community organizations that we work with, state agencies that partner with us, everyone is asking, not just are we collecting the data, but how are we using it to improve the lives of Californians and Americans at large, right? That's an important shift. It's an important shift in looking at why we collect the data. It's not just sitting on a shelf somewhere. We actually, as Aishat mentioned, we need to act upon it. So that's the shift. That's the maturity in which I feel very optimistic about. And so I want to leave the audience with this thought. The future of disaggregation won't be determined by whether we continue to collect this data. It'll be determined by whether communities experience better care because we collected it, right? And as Gretchen mentioned, that's the standard that we need to hold ourselves to.
That's the pearl, how they experience. That is the pearl, experience the care because of what we've done, because of the data that we have collected. I love that. Aishat, data equity, can you define it? And is it attainable? This is from the audience, Yes.
Data equity is where everyone is counted in the data equitably and equally. I think when everyone is being represented in the data, that's when we have achieved health equity. And I do think, or data equity, and I do think it is attainable, as Val and Gretchen both mentioned. I do think the 2024 revision of SPD 15 has taken us into the right direction. And I do think, as how Val mentioned, now that it's becoming operationalized and people are trying to figure out the best way to make this data actionable, we are moving towards a landscape where we are actually going to see how this data can be used to improve the lives of people, to improve their health outcomes, to improve their access to care, to ensure that they receive quality health care. And I think that's when we'll actually be able to say that we have achieved data equity. And when people feel confident enough to say that they have ownership over their data and they feel comfortable that their data is being entrusted in the care of health plans and hospital systems, of providers, and that it's not going to be used against them, I think that's when we can be certain that we have achieved data equity. So yes, I do think data equity is attainable.
Okay, so there is hope, there is opportunity. We have reviewed today what community health looks like from both an experience perspective as well as an operational perspective. And we have held systems of care accountable, those stakeholders within our healthcare ecosystem, to a standard higher than that which we see at the federal level, but that is even more attainable with a great reality of truth at the state and community level. Data is about you. This is about representation of being seen. It's a representation of being counted, and it's about representation of being heard. Because Aishat, you amplified the voices, the storytelling. Val gave us color around the beautiful tapestry of culture and how that plays into this narrative. And so with that, on behalf of the Data Equity Coalition and the numerous chronic disease stakeholders, providers, civic and social justice stakeholders that comprise this beautiful tapestry of data equity advocates, we want to say thank you and gratitude. Please come join us, dataequitycoalition.com, as we continue this narrative, this dialogue. The State Advocacy Toolkit is available for download. And Val, just give us a quick closing salute in your traditional way.
Malo fafitai e tu maupe alvi inga malanganga fafitai e tu mal yova lotatova. May the Creator always be with each of you, bless each of you, and strengthen the community that we have built here today to continue to fight the good fight.
Thank you, everyone. On behalf of the Data Equity Coalition, thank you so much for each of the panelists who've done an amazing job. And to all of our advocates, we owe you a debt of gratitude. Thank you.
Thank you.
Thank you.
Thank you.